But if you think about private exchanges and new provider models, they're important components of a broader shift into what we call Retail 2.0. And Retail 2.0 is characterized by not only channel proliferation, but also other important components like convenience and access. For example, one high-profile health plan CEO says, convenience is the new quality. And if you think about individuals and the retail marketplace and how they care and how they're concerned about both convenience in terms of how they experience the system, but convenience in terms of how they access and learn about the system, you're seeing a huge range of different models and market examples that are out there that are appealing to different segments. Same with engagement and rewards. How do we think about new ways of incentives and reward programs and using peer-to-peer networks and information gathering that are really going to change the dynamic of the retail world. And then value, as prices become more transparency and more responsibilities on the employee, where do they really make those value choices? And what does that mean in terms of how you design products and think about tools that help those consumers make those decisions, whether they're on their own, in the individual market, or as employees as part of an employer-based offering. And then we mentioned channel multiplication, of which we'll talk specifically about private exchanges, but there are all kinds of other models of channel multiplication proliferation that are occurring in the marketplace today as well. So Paul explained what a private exchange was, but why private exchanges and why now? Why do we think that we're at the inflection point for our adoption of that model? Well, a couple of things in terms of, on the left-hand side of the slide here, in terms of some of the drivers for employers, benefits that are continuing to outpace inflation, new ACA regulations and compliance requirements, other pressures to reduce costs and the numbers of resources and human capital departments, workforces that are mobile and multi-state, and then a real need for a differentiated employee value proposition in a marketplace that is, in certain sectors, very, very competitive still. For employees, as they have increased responsibility, increased transparency and choice, be able to navigate and have some guided choice in what that in what those offerings are, and an ever-increasing number of channels and offerings that are out there. And really being able to, have a mobile and social shopping experience that becomes the norm as opposed to becoming what has been dictated to you by your employer. And so private exchanges really can provide that integrated turnkey solutions that addresses those challenges, from the ability to support defined contribution, and Paul mentioned kind of the willingness to go into defined contribution models. We'll talk a little bit more about that in a subsequent slide. The ability to have one-stop shop administration and compliance services that can reduce HR staff and time required, resources. It could be a single national platform. You can have a wide range of benefits and different plans and different benefit solutions that can be offered with clear, standardized information and transparency around each one. And it really starts to resemble and map to a 21st century shopping experience where you know what you're buying, you can understand what you're buying, there's price transparency around that, there's ability to be able to compare and be able to discuss that with your peers and understand that. And private exchanges, as well as other more advanced electronic marketplaces, enable that to occur. Paul mentioned a couple of surveys. What's interesting, and this is some data from surveys that we've conducted, and we probably all of us on this call today have seen multiple different published employer-employee surveys and published opinion pieces from payers, et cetera. But what we see, and we go out and we actively survey every couple of months or so, and what we've seen over the last 18 months, both in our research as well as other third-party published research, is a clear trend. And that clear trend is an ever-increasing understanding of what private exchanges are, ever-increasing attractiveness to what private exchanges are, and ever-increasing intent to moving to one form or another to a private exchange environment. And so whether the key question is how, and Paul mentioned this, is how fast will the adoption curve be, or how steep will the adoption curve be? One thing is sure, that we believe the defined contribution model and private exchanges in their broad definition are here and are here to stay, and we think that the confidence from employers in their ability to be able to have a successful employee offering through a private exchange is increasing rapidly. And I'll show you in a second what our viewpoint is on where we see the market by 2018, sort of 5 years from now in terms of adoption. What would some of the things be that would help to impact this adoption curve? It could be anything from, what is that acceptance of going from conversion from defined benefits to defined contribution, much as it did, as Paul mentioned, in the retirement. Is it going to be quicker, or is it going to be slower adoption curve? I think there's a lot of, we feel strong evidence that believes that adoption curve is going to be more rapid just because of the economics and the pressures around that. We believe one other impact, especially in the small groups side, is how well will shop exchanges be adopted, as shop exchange certainly represents a competitor to private exchanges in the small group market and then increasingly into the middle market as the years go on. What kind of coverage will uninsured individuals actually seek out? So how will the penalties and the subsidies provided by the ACA increase the size of the individual segment? And will the vast majority of uninsured individuals who are subsidy eligible in 2014, how much of them will drive purchase and do so on public exchanges, which would limit the opportunity for private exchanges to gain in these particular areas? And then overall public exchange adoption. So there are a number of different trends at work in terms of impacting the overall growth and adoption of private exchanges. But in one sense, what is that tipping point going to occur? And again, from our research that we've been conducting, looking at the economics that are associated with it, looking at both employee needs as well as employer needs, we see that interest and that level of desire and adoption increasing, and so we're fairly bullish on that. And so if you take a look at the next slide, this is what our modeling that we've developed based on those surveys and other economic analysis has. It says by 2018, we believe that over 60 million lives will be on the public and private exchanges. And so if you look at this chart from left to right, each one of these segments is a total number of each one of these groups, and then the color coding is whether they be off exchange, i.e. in the traditional status quo, be on a private exchange, be on a public exchange, or with public employers and Medicaid. We haven't dove into that sector, but certainly, as you can see, the vast majority of individual lives, because the vast majority of individual lives will be come 2014 will be eligible for subsidies, will buy on the exchanges. They'll go through public exchanges, and then we've modeled out what the size would be for the large commercial mid-market, et cetera. So that's roughly 20% of the total market through some kind of form of exchange by 2018. So it's a fairly bullish perspective. Again, if you talk to both the growth of exchanges, and I'll get into that in a second, but their level of interest that they're seeing from employers, both from the Aon Hewitts at the upper end of the employer size to the regional and mid-market private exchanges that are taking place, they certainly would agree with that adoption curve. In terms of exchange models, we characterize them into 5 different initial private exchange participation models that go in a spectrum from being more much more carrier-centric, i.e. a proprietary carrier platform where it is the carrier that has a technology back end to it, all the way down to the bottom, which is really the exchange owning the customer relationship. And so the big ones are this notion of a carrier-owned, single carrier-owned exchange that has a technology backbone that's delivered by a provider to the same basic flavor but more co-branded with that back-end provider. C is a third-party exchange relationship that's exclusive. So that's why those three, A, B, and C, are grouped together. They're all different flavors of basically a single carrier exchange. D is the classic third-party, Travelocity-like open marketplace with multiple carrier choices, whether there'll be multiple carriers for that can be chosen within a single employer, like an Aon Hewitt model that has risk adjustment, or whether there'll be multiple carriers offered, but the employer has to choose. Ultimately, when they choose, they have to choose only one carrier. To the network rental example, where Buck is saying, we'll rent a provider network, and then go out directly to the employer on an ASO basis and design the product and have a card like that. So those are the ranges of them, from being very much a carrier, single proprietary carrier platform with all the technology underneath it that's white labeled, if you will, to being the more kind of radical end of the spectrum with like what Buck Consultants is doing right now, to probably what most of us in the large end of the employer marketplace are seeing and hearing, the Ken Sperlings of the Aon Hewitts. And if you flip to the next slide here, we've charted out the exchange marketplace, the private exchange marketplace as we see it today. And obviously this is a constantly moving picture and shifting, but we count up to over 30 exchanges and 10 major technology providers that have been announced to date. And as Paul says, undoubtedly there's going to be a ton of consolidation and movement and bankruptcies and buyouts, et cetera, along the dimensions. But this is how we've mapped and categorized them across the defined benefit, defined contribution, employer size, to those five sets that we talked about on the prior slide. It's a very crowded marketplace, and it'll be interesting to see how that shakes out, specifically at the middle market level and the regional level. You've probably all heard about some high-profile examples, Sears and Darden. Sears going from one plan choice to 15 plans, or 4 to 15, and Darden as well. There's some high-profile examples of some major employers that are in a defined contribution model. And I guess from what we've been learning from early results of this, what's interesting is that 25% of folks that are signing up for plans in a defined contribution model are choosing plans that are richer, interestingly, in benefits, and but 42%, according to early returns, are choosing plans that are leaner. And so what's interesting is from that is that this is an indication that real employee transparency and the notion of the two-step sale between the business-to-business and business-to-business to consumer, B2B to C, is a very important notion for payers going forward in terms of their design of the products that they both offer through a proprietary private exchange or through a third-party private exchange. And that employee transparency, that employee freedom to use their defined contribution dollar, it's really up to that individual. And that's why it truly is a segmentation game. Not everyone, we see probably some earlier surveys that were released that said there was high dissatisfaction with employee-based benefit offerings, and 90% would choose a plan that was probably leaner. Once they truly have choice, and once they truly see their dollar, and once they truly understand the value of what they're buying, you get typical segmented behavior. Well, some will stay the same, some will buy up, and in this case, 42% buy down. And so Paul mentioned the DB to DC retirement transition. Will this be more rapid to that? Will it be rapid like the CVHP, doubling in 5 years and up to 20%? That again, time will tell. But we believe that it is here, that it is going to be more and more active, and people are going to adopt more and more quickly over the next couple of years, so that you see the model results that we have by 2018. So let me switch gears now and talk about the second part of the supplier distribution dynamics. And this is really the role of providers in the marketplace going forward in terms of offering benefits through exchanges or even direct to employers, and how that dynamic is going to help shift, in some places have fairly high disruption in the competitive landscape and how benefits are offered or chosen. First, if we think about a provider as a collaborator, both payers and providers are focusing and have focused for some time now on finding ways to deliver better care at more affordable prices. And both sides of that spectrum, payers and providers, understand that there's a capability gap that's not easily filled by either side. And so what we've been seeing over the past few years is a growth in new kinds of collaboration between payers and providers to help fill the gap. Each part taking on some new roles and responsibilities. And we also seen some fairly extreme blurring of the lines as payers enter care delivery actively, or providers that take on risk, like a Cornerstone, for example. And so that although not all providers will be in a position to or want to take on risk or compete for employer business, it's certainly a market reality worth taking seriously. And then if we think about providers as competitors, in the near term, providers may be advantaged over plans in their ability to actually reduce costs and pass those savings on to employers, or through exchanges, public exchanges, pass those savings on to individuals. And we think that providers are as well or better positioned and certainly more nimble potentially than some payers to reduce costs via development of narrow networks. Can they go further and faster than some of their payer competitors, potentially? Can they go further in terms of reducing leakage by changing physician comp systems more quickly? Potentially, yes. And they're certainly potentially advantaged over payers in their ability to coordinate care. So it is interesting to think of them as a competitor in the near term, being able to pull those levers, both either as collaborators or competitors, and to the extent to which they can pull those levers more quickly and be more nimble around that. And then if we think about other forms of employer providers and competing with plans for employer business using new models, there are a number of potential models out there and exemplars. As providers compete for employer business, we think the majority will fall in kind of the first category here, which is competitors like IDSs with multiple facilities and own physicians, or large independent physicians groups, typically beginning with a product such as MA, off the exchange, or migrating small groups and large employer segments as they get more sophisticated. So they look to take on risk for a particular total population where they'll cap with the employer's financial exposure will cap. Other business models might be where on a retail care delivery, whether providers offer a retail front end whereby employers buy the access to convenient care options as a layer in front of the traditional primary care physician as a mechanism to keep costs down. You see that with HEB and Ready Clinic in Texas. Or another potential option is the specialty carve-out, where providers with deep expertise in managing the cost of complex members like cancer patients or end-stage renal disease may approach employers to seek to carve this out and take on the full risk of this management, i.e. directly from the provider to the employer. So, all three of these different flavors will emerge, or could emerge, probably more on the left than the right. But as we think about the shifting dynamics in the marketplace and the role that providers will play, both on the exchange and around the exchange, and then direct to employer as population health managers, it's a different and interesting dynamic to consider as you consider the whole shifting and growth of the retail market and the changing role that consumers will want to play, and therefore the changing role that employers will play in terms of who their suppliers are, who their customers are, and how the choices and value that they offer to their employees. So to wrap up my section here, private exchanges aren't a fad. They're going to be a key component of the future employer benefits marketplace. They certainly don't look alike. There are different geographic focuses, different target employers, different value propositions, different ranges of services, different value-added capabilities. And so as a payer focusing on how to think about them, they really represent the ultimate co-opetition. They are going to control, and the size of the market is going to go through them. And so how you play on them and who you align with and who you target with, it really matters. And it really matters in terms of how you think about your book of business today and how your book of business will look in the future, and what your product portfolio is going to do to map to both all elements of your distribution portfolio, including the different types of private exchanges that you're going to want to do business with in order to continue to have appeal to those segments of your book of business that you want to. And so they represent really a comprehensive retail product and distribution strategy. Private exchanges are just one component of that. And as we just talked about, new entrants and partnerships are going to emerge as meaningful exchange competitors, private exchange, public exchange, and direct-to-employer models too. And the local dynamics, as we all know, are incredibly important here, both in terms of how different they are from market to market and competitive environment, but how important they are to understand them to be able to position yourselves effectively to compete.